Okay, the recording is on. So officially, welcome to our October webinar. This evening, we will be talking about acceptance and commitment therapy and how it can be applied for specifically for hair pulling. For those of you that are here for the first time and don't know me, I'm Dr. Vladimir Miletic, and I am TrickStop's clinical lead and also a psychotherapist working for the program. So these are some of the topics that we will be talking about tonight. Obviously, I will explain what acceptance and commitment therapy is, since that's kind of the basic thing. I will try to present a case as to why this is useful for hair pulling. We will talk about experiential avoidance as a specific concept that's really very important, comes from acceptance and commitment therapy. It's something that we focus on, that if you decide to apply acceptance and commitment therapy on your own or with someone else, this concept will be very important. And if you complete our program, this concept will again be very important. So it is important to understand it. We will be talking about how acceptance and commitment therapy can teach you how to approach your experience in a different way, how to work with thoughts and feelings. And we'll be talking briefly about mindfulness, but not as a type of meditation, but as a concept that's implemented in acceptance and commitment therapy in a slightly different way. And then we will talk about values and behavioral commitment, another important component of acceptance and commitment therapy, or ACT. I will be trying to explain these concepts as briefly as possible, and then give you an example or explain how you can use them to help yourself with hair pulling. When this topic was chosen last month, I was initially quite happy because I think it's an interesting topic. It has some very interesting ideas and concepts and techniques. There are also things about it that annoy me, so that would give me a chance to rant, and I was quite excited. And then as I was making the presentation, I realized that the topic is really huge. It's quite broad. So if there are some concepts from this that you think might be particularly useful to address, you can type them in the Q&A, and then I will put them in the poll for next month, and then you can vote on them, and maybe we can have a whole webinar on some of these techniques or ideas. I've noticed that you tend to choose like a wave of theoretical webinars and then a wave of practical webinars. I tried to make this as practical as possible. I forgot to say in the previous slide, the poll for November is open, and most of you I can see have already voted. If you haven't, please do. When I finish my part of the webinar, I will tell you what topic we'll talk about next month, and then we'll go to the Q&A. So let's get started. So first, what is acceptance and commitment therapy? So acceptance and commitment therapy is a type of cognitive behavioral therapy, or short CBT. It belongs to something that we call the third wave of cognitive therapies. So there are other types of cognitive therapies that belongs in this group, dialectical behavioral therapy being one of them. This one specifically, acceptance and commitment therapy, was developed by Stephen Hayes in the early 80s. He's written quite a lot and taught quite a lot, and he even has books that really digest these ideas in a very simple and easy to use way. So if you want to, after this webinar, if you cannot afford therapy, either with us or with anyone else, and you want to try working on this on your own, he has written at least 2 books that come to my mind that you can use, and you don't have to be a psychologist to understand them and apply these ideas. The way that I see third wave cognitive therapies in general, and specifically acceptance and commitment therapy, is as an attempt to create a kind of deeper or more comprehensive form of CBT, one that goes just beyond these techniques to control thoughts and feelings and remove symptoms. I have a lot of, if you've been to any of the previous webinars, you know that I use specifically acceptance and commitment therapy, as well as other CBT techniques, because they're quite useful and they tend to work well. We have evidence that they work for hair pulling, and I will present some of this evidence to you tonight. My general critique of CBT is that it's extremely shallow and theoretically very half-baked, to put it as simply as I possibly can. Unlike constructivism, which I happen to like, or psychoanalysis, or other types of psychodynamic psychotherapies, CBT doesn't really have something like a personality theory. It's usually just a set of things that you do or ideas that you have to implement. And I think that's the best way to look at acceptance and commitment therapy. Look at this more as a worldview that I'm offering that will help you with hair pulling, but not something that's limited only to hair pulling. You can use these techniques for literally anything else. In fact, I think in a broader way, you will see that acceptance and commitment therapy is more of a lifestyle or an approach to the world, a paradigm, than it is a specific behavioral intervention. If you want, so we can also have a webinar on how to use habit reversal training, for example, step by step for hair pulling, and that will give you even more practical tools. These tools will help you reshape your mind in the long run. So acceptance and commitment therapy is something that works, but it does not work overnight. I prefer it to standard forms of CBT because it does look at human beings in a more comprehensive way. So it does give a fuller picture of humans as they are. It focuses less on these kind of down-to-earth techniques and more on how to approach our feeling and thought patterns in a way that's overall beneficial to us. So it's more holistic, let's say. One of the things that I don't like about it is that I think there are other forms of therapies that use similar ideas and have developed these ideas extensively far, far before CBT even existed. I think there are some ideas that were maybe, they could have been, let's say, referenced better in the source material. And if you come from Japan, for example, you might notice that a lot of these ideas are similar to certain ideas that exist in very specific, in a type of therapy that exists in Japan. That's not a CBT, but it also talks about how we relate to our experience. So unlike standard CBT, which will tell you that your thoughts are irrational and then teach you how to engage with these thoughts, acceptance and commitment therapy takes a different approach. It doesn't tell you that you should be altering your immediate experience, no matter how irrational it may seem, because what we know from empirical evidence, from clinical experience and from studies, is that we can't really do that. Right? Instead, it invites you to do something that to many people seems counterintuitive, which is to open up to your experience and to embrace it. Not necessarily to react to it, as you will see later on, but not to push back on the experience. When in TrickStop, when we try and when we start to implement ideas from acceptance and commitment therapy, I often have this exchange with clients where they seem to think that in working with difficult thoughts, they're supposed to be convincing themselves of something or repeating something. And then people often like to use affirmations, which tend to backfire spectacularly when they're used in a way that contradicts your immediate experience. So Hayes, who invented acceptance and commitment therapy, was observant enough to realize this. Once you have a thought, there's really no point in arguing with it. If you're having a very difficult experience, it may seem like you're having a reaction that's not proportional to what's actually happening, that's not realistic, that's not objective. But he noticed that, whatever your experience might be, there is nothing that you can actually do to make it go away. Like there is no arguing with ruminations. If those thoughts were prone to evidence, they wouldn't be there in the first place usually. So he decided to take a different approach, which is let's just not argue with it. Let's learn how to coexist with it and then act in a way that's useful for us. So the process that acceptance and commitment therapy takes you through has a final goal, which is to produce a kind of psychological flexibility in us. And if you ask me, a lot of the ideas here come from pragmatism, although they're not explicitly referenced. And if you're a philosopher, you might struggle with some ways in which pragmatist ideas are taken here. Some of the ideas come from Buddhism, some of the ideas come from secular versions of mindfulness. So it's like a hodgepodge of all kinds of things. But overall, I think acceptance and commitment therapy has a kind of simplicity that conveys these ideas very clearly. For example, as I was making this presentation, I got annoyed occasionally because I would think, well, this is not new. Constructivism has this and has had this since like the early 50s. Or I would think, well, Buddhists have been doing this for the past couple of thousands of years. But then I thought, yeah, sure, but that involves people learning a lot of new words, a lot of new concepts, whereas acceptance and commitment therapy takes these ideas and then presents them in a way that's very easy to digest, as you will hopefully see by the end of the webinar. So let's consider some basic assumptions. So according to acceptance and commitment therapy, why is it that we have problems at all? And they list several things, and then they make an acronym because that's a very good way to sell and explain an idea. And the acronym is FEAR. So we have problems because we have fear. What does that stand for? Fusion with our thoughts. Fusion with our thoughts means that we take our thoughts as being truths, as being accurate, as being representations of who we are. We tend to think of ourselves as being one with our thoughts. When we talk, so one way that we work with this is to diffuse our thoughts. I will tell you a little bit more about this later and then explain precisely how this is applied to hair pulling. Then E stands for evaluation of our experience, or rather how we judge what's happening to us. Avoidance of our experience is A. This is where I will talk about experiential avoidance a little bit later. And then reason giving for behavior, which is how we justify our actions. And these four combined produce a lot of troubling behavior. And according to acceptance and commitment therapy, all these can be applied to hair pulling as well. What should we be doing instead is to act. See the joke there, you know. So A stands for accept your thoughts and emotions. C stands for choose a direction based on values. And then T stands for taking action. This sounds very simple. And of course, our psychological life never really is. So I will break this down further and help you explain how to apply this to hair pulling. But as you can see, the idea is that you start from where you are. You don't think about where you should be, because that's not a very useful way to go about doing things. We can't always end up where we think we should be, nor do we always need to be where we think that where we should be. Somehow I think Mick Jagger said it simpler in that song, but I hope you get my point. So in acceptance and commitment therapy, we start with acceptance because this is where we are now. And this is how we see ourselves now. Not who we are, but what we see and how we see it. And I will explain how that works later on. Now, let me make a brief case of why use ACT for hair pulling. The gist of this section is because it works. We don't have a whole lot of studies on whether or not it's efficient, but those studies that we do have confirm that it works. The results in terms of the effect sizes, meaning how much it helps you, differ, but the consensus seems to be that it works. I will show you 3 studies here, and then we will briefly go over those results. One thing that you will notice for all 3 of these studies that I will present is that the sample size is rather small. So for example, this article published in 2018 called Acceptance and Commitment Therapy for Trichotillomania, a randomized controlled trial of adolescents and adults, really has only 25 people who completed the treatment and 39 candidates who were found to be eligible for the study. this is barely sufficient to do any meaningful statistics. I mean, I really have to be honest with you there and say that this, I think, has only been published because there's so little research on the topic, and because it's not always very easy to find people to participate in these studies. The treatments but this is what we have, and other studies for other types of therapies, like habit reversal training, for example, which is also well validated, also has these small sample sizes. The treatment in this particular study consisted of only 10 sessions and a protocol, obviously, that was followed so that the researchers could assess the results. Now, the study results, I already kind of colored what the main point is that the study suggests that acceptance and commitment therapy alone is an effective treatment for both adults and adolescents. So just using ACT should be enough to help you. And outcomes appear to be similar to trials that combined ACT and habit reversal training. This second part, I wish they would do another study, but if any one of them is listening, try and compare these, because TrickStop as a program combines both of these, habit reversal and acceptance and commitment therapy. And in my experience, and this could be, I don't know, because of the way that I work or because of the way that TrickStop is structured, but for me, both of these have a place, and they work in different ways. So the way that we do it is that we first apply habit reversal training, because this tends to be very, very empowering, because in only a couple of weeks, people can already see visible results, and they have actions that they can take to stop pulling as it happens. And then we start with acceptance and commitment therapy. So our model follows this, but according to this one study, it really doesn't matter whether or not you combine them, you get the same end result. So this study says that it works. There was another study that was published actually now, like it is about to come out. So I've only managed to read an abstract of the study because it will come out in November of 2021, and I cannot wait to see the whole study because the results seem very promising. So this is an online delivered acceptance and commitment therapy for adolescents with trichotillomania. So again, the number of people who participated in the study is not that large. It's only 28 adolescents that met the criteria to be included in the study. Again, it would be really nice if we had a bigger sample, but we don't. You will see that this is a common topic when it comes to BFRBs. So the conclusion of this study is that medium effect size changes were seen in treatment groups on a measure of trichotillomania-related psychological flexibility, and a small size was seen for psychological distress. What this means is that apparently, when perhaps in another webinar, when I actually get to read the study, I will break it down for you and explain the results further. But based on this, it seems like there was quite a lot of psychological flexibility related to trichotillomania, which means symptom improvement, so less pulling, right? And a different relationship to thoughts and feelings that lead to pulling, but a smaller effect size for psychological distress in general. And this is, I think, due to the fact that it was focused on trichotillomania. When I said that acceptance and commitment therapy can be seen as a kind of lifestyle, as a paradigm, a way of approaching things, I think maybe when you zoom it only to trick, you lose that part. So the overall effect was maybe lesser than it would have been otherwise. Overall, this pilot study shows that acceptance and commitment therapy seems to work even when it's delivered online, which I think is quite important given that the TrickStop is online, and given an even more important fact, which is that we're in the middle of a pandemic and that a lot of us don't really work offline and face-to-face yet. So it is important to know that not only ACT works, but also delivered online. And here's another study that included both people who struggle with hair pulling and skin picking. So it's only a feasibility study, and we can assume that there will be more research done in the future. This study had somewhat larger sample, although it's still not significantly larger. So 40 adult patients participated. They either had trichotillomania or excoriation disorders, or so skin picking. And they also went through 10 weeks of treatment. Incidentally, earlier, before, like years ago, 8 sessions seem to have been the standard. And last year, when we analyzed our own data, what we have from our clients, we saw that people who stay for at least 10 sessions tend to benefit more. And I'm really happy to see that other studies confirm this as well. So they had a protocol which consisted of 10 weeks of ACT-enhanced group behavior. That means group therapy that basically used acceptance and commitment therapy techniques. And results showed significant reduction in hair pulling and skin picking severity from the pre-treatment to the post-treatment period. So when they compared before and after, there was a significant reduction in symptoms. However, it seems that the changes were more permanent for patients with who struggle with skin picking rather than those with hair pulling. So after 12 months, they had, I think, more relapses with people who struggle with hair pulling. This is something, to be perfectly honest, that I also see in clinical work, that hair pulling seems to be slightly more difficult to treat than skin picking. But also, at least in my clinical experience, I cannot speak for the authors of this study, of course. People tend to look for treatment when they've been struggling with trichotillomania longer. And it also tends to coincide with other conditions more frequently. So that makes it a more complex problem. In general, I'm not a big fan, because my worldview is fundamentally constructivist. That means highly individualistic. We need to do studies. And when you do studies, then you need to have a protocol that you need to follow. But overall, 10 weeks might be good for someone, but then maybe 20 weeks is good for someone else. I don't think that we can dictate the tempo equally for every client, because simply speaking, not everyone changes in the same way, right? And because this is only a small study, I think more research is really needed to see why is it that people with trichotillomania tend to relapse a little more. But for you, the message to take away is that if you start applying principles of acceptance and commitment therapy, the best way to look at it is as a set of ideas to embody, not just some techniques to play around with until you get better. Because I think I often see this with people, for example, with competing responses, it's clear what they're meant to do with habit reversal and those kind of basic behavioral interventions. It's very clear that they serve a utilitarian purpose. You're supposed to use them until you get rid of the problem, and then you replace one habit with another and you're fine. But here, because the habits that we're changing are mental habits, people tend to sort of quote unquote become lazy after a while, especially when they experience results, and then they don't mindfully apply these techniques. So they lose the intentionality to the whole thing, and then they relapse into their old patterns of thinking. Hence, I think a part of the relapse. So those are 3 studies. There are more studies. I selected these 3 because they were newer, and because they tested similar 10-week protocols, and because they included both younger clients and, let's say, older clients, or rather adults and adolescents, so that you can see the range and the scope of applicability of acceptance and commitment therapy. Its principles, like I said, are rather easy to understand, although not always easy to apply. So hopefully you will be able to get started on your own after this. If you need any additional literature recommendations or anything, you can email me. You'll have my email at the end of the presentation, and I'll be happy to send you additional materials. So let's talk about experiential avoidance, because I did pompously say that it is very important. If you've been to any of the previous webinars, then you may already know about this concept and understand how it works. We actually last year, I think, had a whole webinar that was devoted specifically to the subject of avoiding difficult emotions. And this is where we elaborated on this much more. I will just go over it briefly now. So experiential avoidance is a group of strategies that we employ so that we don't have to process difficult experiences. You might call them unhealthy coping techniques. But the important thing is that they allow us not to process difficult experiences, right? So hair pulling is obviously one such strategy. It provides a kind of short-term relief from the experiences that we wish to avoid, although this comes at obviously a very high cost. The thing with experiential avoidance is that it tends to reinforce itself because when we want to avoid something, we don't look at what we want to avoid, correct? Like that's just basic. Like if I want to not see something, I will look away. The more I look away, the more my fantasy will make up for the actual reality of what I'm avoiding. And the more that's happening, the scarier the thing that I'm avoiding will become. So if I'm avoiding a mouse, after a while, that mouse will become a giant mutant reptile that will eat me if I finally face it. So avoidance in that way reinforces itself because the object of avoidance becomes vaguer, more difficult to define, therefore scarier. And the scarier it seems, the more you want to avoid it. So there's like this vicious cycle that goes on. Right. So, for example, one way that you can see experiential avoidance at work with hair pulling is, I don't know, perhaps some of you have this experience. I often hear it from my clients that hair pulling helps them focus. And it helps them focus because it provides this kind of short-term relief from something. And that something is usually just something. So you don't have to process it. You don't have to symbolize it. You don't have to think about it, deal with it. You can pull, you can get a little bit of release of tension, of the affect and body excitation that the object of avoidance causes, and then you can direct your attention elsewhere. So what is it that we avoid? This is the tricky part, and this is where your capacity for introspection and your patience or your therapist come into play. Sometimes these mechanisms of avoidance work so well that we actually have no idea what is it that we're avoiding or that we're avoiding anything at all. That is kind of a testament to how efficient they are, right? Sometimes we avoid facing traumas or effects of traumas. Sometimes we use experiential avoidance as a way to regulate our emotions in general. So anything that we find distressing in some way, we will use hair pulling to alleviate. So it doesn't have to be a traumatic event. It can be any event that causes your body to become too excited for you to bear. In fact, sometimes people avoid pleasant experiences too. Sometimes happiness, if it's intense, will trigger people to pull. And I see this especially with younger clients that are 10, 11, 12. They seem to have a hard time tolerating even positive excitement, whereas adults will most often just kind of delegate this to negative emotions. One way to know that you're avoiding something is if the best you can do to describe how you feel is to say that something was uncomfortable. I absolutely detest that word because it means nothing. It is highly psychologically uninformative, but it's also a testament to how well experiential avoidance works. One thing is that we can use hair pulling to get out of loops of thinking and rumination. Like if you have too much on your plate and then you keep spinning this in your head, one way to get out of this is by hair pulling. It can be a way to avoid looking at our boundaries when we feel like we cannot live up to the image that we set for ourselves. Then hair pulling can be a great way to distract ourselves from actually looking at where our limitations are. Sometimes it can be a way to preserve relationships because pulling can be a way to mitigate anger, for example, or hostility, or even disgust or dissatisfaction when our needs are not met. Sometimes instead of setting boundaries with other people and saying no to certain things, we might resort to pulling, because that is a way to gain release or gratification without actually having to face the event, right? The trouble with this, again, is that it works so well that we, at the end of the day, when these mechanisms are in place for so long, we don't even know anymore what is it that we're avoiding. And that makes, as you can imagine, that makes treatment quite tricky and difficult, because your job is to learn to face, tolerate, and live with these uncomfortable events, and you don't even know what they are. So this is a place where, if you want to work on your own, I think, for example, journaling is a great way to do that, and cultivating all kinds of practices that will make you more aware of your body. Because when we suppress content or repress it, one of the first places where it comes out is our body. Whether it's a symptom in a certain part of our body, whether it's a psychosomatic issue, whether it's just our heart beating in certain situations or our palms sweating. So our body usually tells us what's happening beneath the surface. It's like the lowest level of symbolism that our psyche can send out. So focusing on your body by doing, let's say, body scans can reveal quite a lot about what causes stress, what causes sadness, anger, conflict. If you practice mindfulness, so not mindfulness without meditation that's implemented in this form of therapy. I mean mindfulness, like sitting there 20 minutes at least every day, observing your thoughts and emotions. Over time, if you couple that with journaling, you can learn to associate how your body reacts to certain thoughts and memories that will arise. And that will give you a fuller picture of what is it that you avoid. Because mindfulness is a direct antidote to experiential avoidance. Because mindfulness exactly is the opposite. It's just sitting with your experience, whatever it is. I do have to say, you might have noticed that I recommend mindfulness as often as I possibly can. I think the only thing that I plug more than mindfulness is constructivism. But the reason why I think mindfulness is good is because it is a way to do introspection without having to share things that are too delicate to be shared with other people. Sometimes, because of all the shame and guilt and stigma associated with it, we will not bounce off our ideas and thoughts with our loved ones and people who are close to us. In fact, people who struggle with trick often hide it so well that I've seen people be married to someone for years and their partner doesn't know that they have bald patches, for example. I find that to be quite fascinating, to be honest, the inventiveness that people will put into hiding their symptoms. And sometimes I think perhaps willful inattention on the part of their partners in not noticing something that they're not supposed to notice. So one of the ways to actually reverse experiential avoidance would be to be mindful of things. I started on this mindfulness tangent for a reason, because of the first thing on the list here, which is trauma. Now, mindfulness is known to be very helpful with PTSD. But if you have PTSD or complex PTSD to boot, I think the best way for you to practice any mindfulness-based technique is with a qualified teacher. We have a lot of apps that you can download for free. I can send you tons of guided meditations. I've shared them before. So the resources are there and they're available. And there are like dozens, thousands of books probably written on it. However, when it comes to people who have a history of psychosis or people who have PTSD, applying mindfulness in a way that's not skillful can backfire in a very, very serious way. Or bipolar disorder, you can add that to that list as well. So in that case, you need a qualified teacher. And when I say that, I don't mean every person who has a Udemy certificate or someone who meditated for 7 minutes a day for 2 months, got themselves a certificate, and now call themselves teachers. I mean people who have serious psychological training behind them, or alternatively, Buddhist monks. This might sound like an off the field recommendation, but Buddhism has its own mind training system. Obviously, mindfulness is something that we took mainly from there. And Buddhism has a very elaborate psychological system that has been in existence for a couple of thousand years. And well-trained Buddhist monks will teach you how to meditate basically for free or for crumbs, essentially. And they are really very trained, and they will know how to handle intense emotions. I cannot tell you over the years how many clients I've had who come and then tell me, can you please help me? Because I've had 2 or 3 mindfulness teachers before, and they've only made things worse. So in that sense, it really is important to have a qualified teacher who both knows about psychology and also has extensive practice behind them, because mindfulness is not something you can teach just by giving instructions. To resolve dilemmas that arise in real time, you need actual experience with it. Now, what I was basically doing now was praising experiential avoidance as this very efficient method of not looking at the dark side that we all have. So you might think, if it's so efficient, why not develop another form of avoidance that includes pulling? That doesn't include pulling, sorry. I've been asked this question many times, so here are some of my answers. One is that distress in its many forms is really an unavoidable part of life. Like, we cannot numb ourselves to unhappiness, to anxiety, to guilt. Without these bad experiences, we also don't have good experiences either. One of the great lessons that constructivism gave me, at least psychological constructivism, is that the way we structure our experience is in these binary opposites. If you numb yourself to the pain that you're experiencing, by definition, you're numbing yourself to the pleasure as well, because they go one with the other. So distress in some form is an essential part of life. If you think about it, and if you know Buddhism, this is, I believe, the first noble truth, actually. So the fundamental idea behind Buddhism is that there is just suffering in life. And to me, this isn't just an existential fact. Avoiding something that is so basic to human experience is not healthy. So there is no life without some degree of distress. We can either learn how to deal with it or forever come up with dysfunctional strategies to remove ourselves from it and fail in the end. Because hair pulling, it might work for 5 minutes, but over the course of years, it leads to bald patches and all other complications, not to mention shame and guilt, which are even more distressing usually than the thing that we're originally trying to avoid. It's a short-term strategy, so it requires continuous repetition, hence the permanent damage that is done for people who pull for very, very long periods of time. It causes shame, guilt, and then consequently, it affects our self-worth and our self-esteem. Self-esteem, to begin with, is a horrible concept because it leaves our well-being in the hands of external validation. So that's not something that I recommend the people cultivate. I think self-worth is a healthier concept because it basically means that you're a worthy person just because you're alive, and you develop your own set of principles that you follow. So you are the master of your own validation or invalidation. That is one way to remove a layer of suffering that comes from trying to compare yourself to other people or live up to other people's standards. And in the end, using experiential avoidance actually prevents us from living an authentic life. This means that we're not able to work towards realizing our goals and our values. And the first and the last ones are really, I think, the best arguments I have as to why you should not be avoiding difficult experiences, because you are avoiding life. Or as Virginia Woolf once put it in a letter to her husband, you cannot avoid, well, now I forgot, but it's something like you cannot avoid pain by avoiding life, or something like this. Such a short quote, and then when you need it, it disappears. Oh well. So let's see how we can apply ideas from acceptance and commitment therapy specifically to hair pulling, and what does that mean, and how is it that you should start retraining your life. I will give you some core ideas here. And then before I explain how each of these is applied, I would tell you that if you want to work on this on your own, and you can, it just requires time, I would advise you to first find an accountability partner. This is very important. So just find someone who either you trust or someone that struggles with the same thing. Like you can go to our Facebook group, and because it's a closed group, so there are no trolls there, and it's kind of a safe environment. Go and just put an ad there and say that you're looking for someone to work with, and then meet once in a while, let's say once every 2 weeks or once a month, and then go over these together and just work through it together, because it really does help to have someone that goes through this with you. In fact, there are some studies about CBT specifically, different types of CBT actually, that show that it's not quite certain whether or not it's the techniques themselves or the fact that you apply them through a relationship with a therapist that works. In my opinion, it's probably both, but I think the relationship aspect is quite important, because then you have someone to share your suffering with, right? So that would be one thing. And the second thing is to use journaling, and journal as much as possible, and then review those journals every once in a while, because this is an excellent way to learn more about your thought patterns. The way that we have habits in behavior, and the way that hair pulling has its habitual component, we also have patterns and habits of thought, and these are much more difficult to identify. So journaling is an extremely powerful tool. And also journaling is a way to keep yourself accountable. And if you're a creative person that likes arts and crafts, this can work very well for you. Anyways, core principles of acceptance and commitment therapy. First, reducing or eliminating our tendency to reify thoughts, images, emotions, and memories. Or as George Kelly would say, it's all just constructs, and we just tend to forget that. Second is acceptance, meaning that we allow experiences to come and go without trying to interfere too much. One is that we try to stay in contact with our present moment reality, that we're developing something called the observing self. And I actually think this is a very profound, a very radical idea. It's been presented here in a very pared down version, but in Buddhism, this is elaborated on endlessly, and it's fascinating. So I advise you to read up on that a little bit more. 5 is to work with your values and discover what is it that's actually important to you in your life, and then to commit yourself to goals and actions that will lead you to come closer to your values. And now I will explain how each of these relates to hair pulling. So first is the tendency to reify constructs. I put constructs here, even though in acceptance and commitment therapy, no one uses that term, but so that I don't have to repeat thoughts, feelings, images, all of these are just constructs for me. So tendency to reify constructs. Reification is a process by which we make something seem real, or we treat something as real. For example, we don't do this with every thought that we have. We all have thoughts that we clearly see as metaphorical. I always give a thought that makes me look like a complete homicidal maniac, but I think that this is a common thought. So around the corner at my place in Miami, there's this lady who works at the cash register, and she doesn't know how to use any of that. And I remember once I went there to buy a couple of things, and then she was trying to use my card once, twice, 3 times, and she says, your card doesn't work, it's not magnetized. And I'm like, no, it works, you just don't know how to use the thing. And we just go through that every time. And I was late for a session, and I was in a hurry, and she was too busy explaining to me that it's not her, it's me. And I had this very clear thought, which was, I'm going to now jump over and just strangle you. Now, it was a very, very clear thought in my mind that I just had a thought about killing this person. Not a very flattering thing, but I have to say that I didn't really get very upset, because I know that this thought is not something I would ever act on. I'll kill you, for me, has a clearly metaphorical meaning. And the meaning was, lady, you're frustrating me, and I really don't have time for this crap, because I have a session and I have to go upstairs and prepare. right? So we have a lot of these thoughts, like like we have thousands and thousands and thousands of thoughts that we don't take seriously, that sound weird when you say them out loud, but you kind of know that they're not true. So people will say, I'm an OCD person all the time. And that very rarely actually means that they have obsessive compulsive disorder. It just usually means they're neat. And no one even thinks that they have OCD. They just kind of understand that as a perhaps misplaced comparison, but just that, a metaphor, nothing else. And then there are those thoughts that we ratify, that we take as absolute truths and as proofs of something. And acceptance and commitment therapy tells us that these thoughts, at least as they tend to revolve around pulling, are thoughts that need to be what we call diffused in acceptance and commitment therapy, because we're fused with them, and then we need to separate ourselves from them. Once we separate ourselves from these thoughts, we see that they're just thoughts. Thoughts are merely mental events. They bear absolutely no relationship to external reality whatsoever, and we usually just pretend that they do and behave as if they do. Because even evolutionary psychologists, and I'm really not a big fan of evolutionary psychology. In fact, I actually strongly dislike it. But even they have very good arguments in favor of this. Our brains didn't evolve to know what's true or even what's real. They evolved so that we can survive. So in terms of evolution, the very capacity to have thoughts is really just a survival tool. A tool doesn't have to be true or accurate even for you to survive. It just has to work. And this is what we kind of don't pay attention to or aren't even aware in our real life. Constructivism puts this as explicitly as possible, and constructivists have known this far, far, far before acceptance and commitment therapy came into existence. But everything that we think is always an interpretation of reality, not reality itself. In fact, if you think about it, the way that our eyes work, our sense of touch, smell, taste, none of it is immediate. We're actually not very connected to the external world directly. Touch is just how our body how our brain reconstructs electrical impulses that arise when something activates receptors in our cells, right? And so thoughts are just that. They're just certain interpretations of the world. And thoughts around hair pulling, those that either trigger the urge to pull or thoughts that are manifestations of the urge to pull, are reified thoughts. And in acceptance and commitment therapy, what we do is we actively try to get our clients to de-reify them, to diffuse them, to separate themselves from those thoughts. So if you have a thought, I need to pull this hair, for example, one way that you can do it is to just kind of pause for a second and then actively correct your brain. Just remember one thing when it comes to this. Habits are established by repetition. Hair pulling became habitual because it was repeated over and over again, and because it was gratifying for one reason or another, right? So you need to do this over and over again. This is a process that requires commitment. And in my opinion, it's a process that should be applied to a lot of thoughts, not just those that lead to pulling. Because the idea is not to learn to diffuse only a few thoughts, but to learn to relate differently to the process of thinking itself. So I need to pull this hair is not a fact of your experience. It's not the truth of anything. It is just a thought that will eventually go away, because they all do. So what we do in acceptance and commitment therapy is learn to look at thoughts like this as, I'm experiencing the need to pull my hair. And I could be experiencing pain, for example, in my chest, but that doesn't mean that I'm having a heart attack, right? There's like a gazillion other explanations for that. And usually, so far, it never was a heart attack, right? For example, this hair has a different texture, which is something that people feel can be diffused in the following way. I'm experiencing that this hair has a different texture, or as different, and this is leading me to want to remove it. So here what we do is we're emphasizing that we're having a thought a thought that we take as truth, and then that we have an emotional or a behavioral consequence of this reification. Or one thought that people have so many times is, I'm a failure. So it's not, I made a mistake and this is making me feel bad, or I currently see myself as a failure and this is leading me to feel frustrated. It's, I'm a failure. When you use I am a failure, I think this is maybe the clearest example of reification. You're actually declaring that you are essentially something. And acceptance and commitment therapy tells us that, and constructivism and common sense also tells us, that this is false. You feel like something, or you have a thought about something. A feeling can lead to a thought can lead to a feeling. And very often when it comes to hair pulling, it's this internal loop that people are stuck in. It has nothing to do with the external world. So this is how we work with the tendency to ratify our experiences. The second concept was acceptance. Acceptance, so this one seems to be easy for people to understand, although they don't understand that this requires practice and vigilance. So this is not a way of thinking that you're going to just adopt. If you have a meditation practice, this may actually slowly become a second nature, even without active involvement, because meditation teaches you to just look at thoughts as passing events, the way you would hear noise outside, for example. It's also a way to get there. But acceptance is more misunderstood. And when we mention acceptance in therapy, people often hear something entirely different, which is, don't bother changing, just give up. That is not what acceptance means. So acceptance is a very simple concept. It just means seeing things clearly. It means acknowledging what is happening right now. It doesn't mean that you have to like it. It doesn't mean that you have to do things so that this condition occurs again. It just means that it is occurring right now. So acceptance is actually means embracing a difficult experience instead of fighting it. Do you know that experiment? It's quite famous when psychologists told people not to think about white rabbits, and then white rabbit is the only thing they could think about. Well, this is what happens when you try to not accept your experiences. The more you push them away, the more energy you give them, the more you feed them, and then the stronger they become. When you just accept that they're there, they come and then they go carried by their own inertia and their own pace, right? But the more you push them, the more energy you give them. One way of looking at this is kind of like trolls online, and this goes for thoughts as well. The worst thing when you come across a troll on the internet, the worst thing you can do is actually try to engage in conversation with them, because you never win, and they always get their fun because they ask the most ridiculous questions and continuously avoid giving clear answers just so that they would annoy you. And this also happens when we try to fight our experience. So if you're having a thought that you are a failure who will never stop pulling, there's no reason why you would sit there and then tell yourself, you know what, you're not really a failure, you're really a great person. Because in that moment, if you feel like a failure, that is something to accept. That is the reality of your experience. And this is also one of the reasons, let me rant just for 30 seconds and then I promise I'll stop, why I don't like when people use affirmations. Because affirmations are often meant to convince you of something that is experientially just not true. A person with low self-esteem, if they keep repeating, I am amazing, they're not going to start thinking they're amazing. They will feel worse because they will be rejecting, their whole body will be rejecting the idea, right? Even in meditation, when we cultivate certain emotional states, we never say, I'm full of loving kindness. You will say something like, may I be free from suffering, or may I live with ease. Something that is more proactive and something that is more of a desire than it is a statement of reality. So acceptance is extremely important, but it doesn't mean that we give up change. It just means that we can see clearly what's happening. And that is, if you think about it, the only way to actually solve a problem. To do psychological change, without acceptance is kind of like doing surgery, but you can't look at blood or guts. I would not recommend that surgeon. Now, present moment awareness. This is where mindfulness comes in, except that, of course, here they don't, acceptance and commitment therapy doesn't make you meditate. Usually I do that, but theory and therapy itself doesn't. What it does instead is kind of encourages people to stay present with their immediate sensory experience. For one, you can actually use this as a kind of grounding. And second of all, if you're present with what is happening right now, you're far less likely to fall into the trap of ruminating on the same thought over and over and over again, because our immediate experience is always quite rich with sensory data. So for example, I'm sitting now and my elbow is on the table, and that's not very comfortable, so I just moved it, thanks to mindfulness. But like I can feel how comfortable my chair is. I actually, if you ask me why I used the image of this mountain, I have no freaking idea. I just really like it. And it kind of transports me to another place. So this is also a part of my present moment awareness. There's a lamp here that I put so that I don't have to use any other outside of light. That's also a bad part of my my current experience. So present moment awareness is something that will get you out of your head, to put it simply. So even though, like I said, you don't need to actually sit and meditate, I do encourage it. And what you can do in order to implement present moment awareness, because this is not easy, you can give yourself little informal mindfulness tasks every day. What I like to do is every time I walk through a door, and you can't see it, but there's like 1, 2, 3, 4 doors from my office leading to other rooms. Every time I pass through a door, I will do like a quick check-in with my body. I will feel what's happening in my chest and my shoulders. My chest because of my overall emotional state, my shoulders because of tension. And then over time, that kind of becomes a habit. So you learn how to return to the present moment awareness. Now, the observing self. So think about it like this. If you're not the thoughts that you're thinking, because they're just mental events that come and go, if you're not what you feel, then you are the awareness of all that, right? This is about as simple as I can put it. And Hayes has a very nice down-to-earth way of explaining it. Every time I try to go in depth in this, I end up explaining how Buddhists see the mind and talk about Dzogchen, and then people hate me. So I'm going to refrain myself. But let's say that one of the things that we try to do in acceptance and commitment therapy is develop a kind of metacognitive position, meaning that you observe your own processes and you feel them, but you don't identify with them. You identify more with the awareness of them, right? So you detach yourself, but don't dissociate yourself. This is, I guess, one way to put it practically, how that happens. In reality, what that means is that when you feel the urge to pull, instead of immediately obviously pulling, you first think, okay, let's break this experience down. So it can have thoughts, it can contain emotions, it can contain memories. If it's thoughts, list them, which ones? 1, 2, 3, 4, 5, 6, 7, or write them down. If it's body sensations, what is it? Is it something in your throat? Is it something in your chest? Is it something in your abdomen? Do you feel tingling in your fingers? Do you feel itching on your skin? So that would be the observing self. And just developing a habit of breaking down your experience to these elemental components, you will be creating that distance that I'm talking about. This allows you to make decisions based on your values and not on impermanent private experiences. So not based on what you feel in the moment and what will go away in about 30 seconds. When I say 30 seconds, I do mean it metaphorically. I know that the urge can last longer than that. But the point is that whatever sensation arises, it always also passes away. Now, values. So when we talk about values, there are two different things that we need to separate. One is, what do you want your life to stand for and not on? I don't know, what was I thinking? One of my New Year's resolutions was not to use a spell check. Because I realized that spell checking is making me illiterate, and here's a living proof here. So yeah, I apologize. Anyways, uh, there are the shoulds of our life, like things that should be our values, and then things based on which we actually make decisions in life. As a therapist, I'm interested in how we fantasize about ourselves, but only to a certain extent and to a certain degree. But what I'm more actually interested in is in the reality of your life. What is it that you base your decisions on? What are the values that you use, not the values that you profess? Right. So that's one thing. In acceptance and commitment therapy, we spend a lot of time trying to figure out what our values are. And then we try to, at least I do, we try to establish a twofold connection between hair pulling and those values. First, and more obvious, we look at values as tools that can stop us from pulling. So something that can be a source of willingness and something that can give us direction for specific action, right? But then we also look at values as causes of pulling. This is not always very obvious, and sometimes people resist the idea very much to the point that they even get upset when I mention it. But for example, sometimes people will have a value that they have to do everything for their loved ones, or the people who are religious will sometimes have a value that they somehow have to be selfless. And then this selflessness will have its ugly side, which is a complete disregard for their own psychological needs. And then when they neglect themselves, they're also less likely to be efficient in helping others, leading them to feel bad about themselves. There's nothing wrong and nothing bad about selflessness as a value, but what the problem here is how that value is being actualized in real life. So how one relates to the value. That's one way in which values can actually facilitate pulling. Everyone who's a perfectionist, I'm sure, intimately knows how that works, because boundaries are ignored, momentary limitations are ignored. There are only things that should be done and must be done, and everything else is horrible. And that can generate a lot of negative affect that then we want to run away from, and pulling serves as a way to run away from it. And then finally, we have committed action. So values are not something that we can achieve. Values are, they're like the ideal, right? Because we're not ideal beings. Humans are very sloppy and messy, so we never really get to achieve what we want, exactly our value. But what we can do is commit ourselves to act in that direction. So we learn how to set realistic goals and well-timed goals that are always in accordance with our values. The observing self, present moment awareness, and diffusing difficult thoughts gives us that little space that we need so that we can think what a value-based decision is once a difficult experience comes along. So all these techniques actually help you live a more authentic life, because you will make decisions based on what the core of your being is, right? And of course, commitment to our values is a source of motivation or willingness, our openness to try out different things to help ourselves. Now, these are just, in the end, 3 short remarks, and then we will go to the Q&A. Remarks are on time, patience, and kindness. Ideas presented here all require time. I've said this before a million times, but there is no such thing as a life hack in psychotherapy. It just doesn't. Change never happens over time. Anyone who promises you change over time is a snake oil salesman. So that you need time. That's one, because what we're talking about here is seriously changing the way that we relate to our experience. And it's a change not only for us as people, it's also a change that significantly, I think, departs from the cultural zeitgeist, because we are taught to take ourselves too seriously. And if I had to summarize acceptance and commitment therapy in one short sentence, it would be, don't take it all too seriously in terms of your own experiences. This sounds almost heretical to some people. Actually, my younger client, I've noticed that I like to use humor in therapy, because I think humor allows us to talk about difficult things in a way that makes it slightly easier. And humor also provides that distance. Of course, I'm not talking about offending anyone. I'm talking about benevolent, well-meaning humor. But I've noticed, for example, that younger clients, like adolescents or people in their early 20s, tend to react differently to humor than people in their 30s and their 40s, which I think signifies a kind of generational shift. Whereas young people, I guess this also comes with the fact that I've had a lot of therapy of my own to become a therapist, and that I've been meditating for longer than some of my clients have been alive. But I like to laugh at myself, and people sometimes don't. So I had to learn over time that I have to kind of adjust my approach. The reason why I'm saying this is that uh, understanding your thoughts as just a thought that bears no significance is really contrary to the narcissistic culture that we live in, that teaches us that everything we feel, do, see, hear, think, or ever utter is just priceless and something to be cherished. So in that sense, this change requires time because our culture also works against it. By incorporating principles of ACT in your life, you're really just transforming yourself beyond just working on pulling. I mean, all of these things are easily generalizable to any other aspect of your life. And I think the more you generalize them, the faster they will actually be embodied in your behavior, right? And our experience is always integral at the end of the day, so you can't partially alter it. Even in that study where general distress flexibility was slightly less than just related to trick, it still existed, meaning that even though the therapy was applied specifically to trichotillomania, its effects were slightly wider. This is because you can't understand just thoughts around trick as being mental events and nothing else without applying that principle to other areas of your life, although this takes time. Now, patience is just respect for the time that is needed for a process of change to reach its end. It's really a respect for our pace of change. Therapy accelerates this for sure, but there's only so much that we can accelerate it. We cannot force it. Some things simply require change, especially the more important and the greater the change is, the more time it requires to change it. Because our identity seems more real to us than some peripheral things. And then when we have to change something that our identity is based on, that requires a lot of time, a lot of effort, and a lot of pain. It actually requires a kind of process of mourning, kind of, almost as if someone is dying, a part of us. And when hair pulling goes on for a long time, and I'm talking decades here, people tend to somehow structure parts of themselves around pulling. So giving that up is giving up an important pillar of who they are, an unhealthy, a painful pillar, but a pillar nonetheless. So having patience means being respectful of the magnitude of change that you're undergoing. Psychotherapy and in general change outside of therapy is not surgery. Even surgery requires recovery periods that vary from person to person. So patience includes learning to tolerate failure, relapses. It means working on accepting those less pleasant and downright awful parts of ourselves, and we all have them. Sometimes when I sit down to meditate, or when I talk to my therapist, I think like, what kind of a trash can my mind is I wonder, well, where do these thoughts actually come from? I mean, I don't know the answer to that, and it doesn't even matter. It's just that my point is that I'm not sitting here from some enlightened throne telling you, how to enlighten yourself. We're all deeply flawed human beings, and we're sometimes very dark and morbid, and we have to embrace that as well, because that is also part of who we are. Especially if we want to change it, we have to embrace it. And then kindness. Thapten Jimpa, who was the translator for Dalai Lama for a long time, wrote a book about compassion, and he called kindness compassion in action. Compassion, in turn, is just the desire to alleviate suffering. And this is a key component to change. Being hard on yourself is going to make the whole process that much more difficult. It's going to make you more frustrated. It's going to make you have more relapses, and your relapses will be harder if you're hard on yourself. So don't be. Sounds so simple, doesn't it? So it follows naturally from how I define this, that without kindness towards yourself, when you fail and when you're being vulnerable, there really is no change. In fact, if you judge yourself, there's just more frustration. And when there's more frustration, then there's also more pulling. The biggest obstacle, in my experience, that people face on their way to recovery is precisely this: the idea that when we fail, we should actually be nice to ourselves. And the paradox is that it's very easy for us to be nice to other people when they fail and when they suffer, because we can see their suffering and we can recognize that we need to help them suffer less. But when it comes to ourselves, this is one huge blind spot. And oftentimes, I think half of the process revolves around this. And this is where I will leave you. And now we will close the poll and go to the Q&A.